Developments in pharmaceutical research and medical technology have pushed up prices. Some public insurers have imposed surcharges in an effort to stay within their budgets. Private insurance companies, funded largely by high earners, are able to pay for more certain treatments. That is a far cry from socialism, say people on the public plan, who complain they're second-class patients.
Ursula Lieniger is on her way to her doctor. The pensioner from Hamburg is a diabetic and has regular appointments. Like many Germans, Ursula Lieniger has to shoulder an increasing part of her treatment costs herself. She has to pay for some of her medication, a quarterly €10 contribution for office visits, and any treatment not considered standard by health insurers. Ursula Lieniger finds it hard to keep paying all the extra costs.
All that is covered by the one-off payment. There's no provision for those who need more care or less.
As a result, patients don't get treatment if the insurance refuses to pay, something Ursula Lieniger has also experienced.
Once I was in the hospital, and it seemed to me that I was released too early. I continued to have the problem for 6 days at home until I found a way to treat it myself. I didn't find that very good at all.
There doesn't seem to be much hope that things will improve.
I think it will be very difficult and the situation will get worse. I'm absolutely sure about that. And your additional costs are bound to rise, Mrs. Lieniger. That's how it is.
Ursula Lieniger will have to pay for some of her medication this time, too. Few patients, if any, believe that future reforms of the system will make things cheaper for them.
Germany has made several efforts to restructure healthcare, but they have been only partially effective at keeping costs in line. The result is a complex mix of free market and state control. Patients have more or less free choice of doctors, for example, but physicians must meet certain budgetary limits on the value of the medicines and treatments they prescribe. Critics say inefficiency and bureaucracy are pushing up costs. Some want less regulation, others more. There are calls for caps on physicians' fees and the cost of medication.
After a prolonged protest, German doctors got a pay hike last year. Insurance companies say there's no room for more.
We're seeing income levels in our economy stagnate. So why should doctors be exempt from this trend?
Many customers at the Chemnitz pharmacy complain that despite having insurance, they're having to pay ever more. Kerstin Chemnitz believes that German politicians have not explained all the issues involved in rising healthcare costs. That's something they need to address to make healthcare reform more transparent.
Lawmakers have just begun negotiating yet another reform. The health ministry is in the hands of the junior coalition partner, the business-friendly Free Democrats, and they're calling for a new flat-rate health fee under which everyone would pay the same amount for insurance. The Social Democrats want those with higher incomes to pay more, as they have until now.
Its planning is a new healthcare premium payment, also known as the individual fixed rate.
It's more just and would allow competition in the system and help keep costs under control.
Rösler's plans would see all insured persons paying the same contribution regardless of what they earn. Employers would also contribute, but to a lesser degree than before. Low earners would see their contributions subsidized by the state. Critics say that could end up being expensive, costing as much as €30 billion. The opposition Social Democrats say it's not only expensive, it's unjust as well. And with 2/3 of Germans rejecting Rösler's proposals, they sense they've got support for their campaign against the fixed-rate contribution.
Healthcare is based on solidarity. People who earn more also contribute more. The new plans would abolish that principle and be socially unjust.
The Social Democrats have their own reform plan. They want to abolish the current two-track system. Germany is the only EU state where high earners and the self-employed can take out private insurance policies. The remaining 90% of the population is obliged to pay for coverage in public insurers. The SPD wants to see everyone pay into one system, a citizens' insurance fund. Under their scheme, both workers and employers would pay equal contributions into the fund. The cost of coverage wouldn't just be based on salary, but also on other measures, like income from any capital the insured person may have. But Philipp Rösler is sticking to his guns with the individual fixed contribution. The cabinet is set to decide just how this could be implemented.
And that's been our in-depth report. Thanks for watching.